sir.
The sympathomimetic drugs were classified as the catecholamines or the non-coated catecholamines. The other group was that of the drugs acting on the alpha receptors and beta receptor, and another classification is the drugs, sympathomimetic drugs which act directly or indirectly. We studied the drugs which acted directly, that were, for example, the epinephrine, norepinephrine, dopamine, and phenol-dopamine, etc. These were the drugs which acted directly on the receptors, both on the alpha and the beta receptor. Now the next one, that's those drugs which act indirectly on the receptors. That these drugs have mostly no effect on the post-synaptic receptors, but these drugs cause two actions. That's number one, either they increase the release of the catecholamine, that is the epinephrine or norepinephrine or dopamine, from the nerve endings, which are accumulated in the synaptic gap in the synapse, and then they act on the postsynaptic receptors. This is the one method. The other method is that, as we have seen, how the action of the catecholamines is finished. The action of the catecholamines is finished, terminated, that either they are metabolized by the catechol O-methyl transferase or by the monoaminoxidase, by these two enzymes. Another is the diffusion of the catecholamines into the peripheral tissues, and the third is its reuptake by the nerve endings. This is the most important method of determination of the action of the catecholamines. These drugs either increase the release of the catecholamines from the nerve endings, or secondly, they inhibit the reuptake of the catecholamines in the nerve endings. In this way, they increase the concentration in the synapses and have their pronounced action. Amongst these acting is the amphetamine. Amphetamine, dex, amphetamine, methylamphetamine. These are the drugs which enhances or which facilitates the actions of facilitates the release of the catecholamines, that is of the norepinephrine or epinephrine or the dopamine from the nerve endings. These drugs, this amphetamine, methylamphetamine, dexamphetamine, these are the drugs which are orally effective. Epinephrine, norepinephrine, dopamine, they were not effective orally. But these drugs, this amphetamine, methylamphetamine, dexamphetamine, these are orally effective, and this crosses the blood-brain barrier where they cause the stimulation of the central nervous system. These are the drugs of abuse. By releasing the catecholamines which act on the alpha receptor and beta receptors, by acting on the alpha receptors, these cause the vasoconstriction, rise of the blood pressure, and by acting on the beta receptors, beta 1 receptors especially, they cause positive inotropic and chronotropic effect. They increases the heart rate and they increase the force of the contraction. They cause the tachycardia, and in overdosage may cause cardiac arrhythmias. Another drug that is related to the amphetamine is the methylphenidate. Methylphenidate. It's very popular. Trade name is Ritalin. It also acts, although it is different chemically from the amphetamines, These act most commonly on the central nervous system, and this drug has all the actions of the amphetamine. It is most commonly used in the treatment of attention deficit hyperactive disorder. Attention deficit hyperactivity. This disease occurs in the children in which the child is hyperactive. He has got no attention to his works. Whenever he is involved in a job, in a work, he acts there for only a few minutes, and then his attention is diverted to another side. This is the disease of the children, and paradoxically, this Ritalin, this methylphenidate is a stimulant of the central nervous system, but in some way it decreases the hyperactivity of the children. Now, next, another one is the modafinil. This is a drug. The exact mechanism is not known, but however, it is said that it inhibits the reuptake of the catecholamines from the nerve ending. It increases the synaptic concentration of the catecholamines. It is most commonly used in the treatment of narcolepsy. Narcolepsy is a disease in which there are brief episodes of compulsive sleep for a short duration of action, compulsive. This drug also causes moderate tachycardia and mild rise of the blood pressure. Then there is another compound which is known as the tyramine. Tyramine is a byproduct of the tyrosine, which is used in the synthesis of the epinephrine and norepinephrine. This tyramine is produced by the fermentation of those substances which contain high proteins. For example, these are present in the chicken liver, in the red wine. Normally, when this tyramine is taken up, it has got no pronounced action because this is metabolized by the MAO, monoamine oxidase. It is metabolized immediately and it has got no effect, no psychotomimetic action. But in those persons who are suffering from depression and they are given some drugs which inhibit the action of monoamine oxidase, that is monoamine oxidase inhibitors used in the treatment of the depression. In those patients, if tyramine is given or if it is taken, or the foods which contain tyramine are taken, they are not metabolized and they are absorbed and they have got intense psychotomimetic action. There is a severe rise of the blood pressure, tachycardia. So those persons who are taking monoamine oxidase inhibitors in the treatment of depression should be careful in taking all these substances, for example, red wine or the chicken liver, etc. This is also present in the cheese, the chicken liver, chocolate, the smoked fish, red wine. The next one is the cocaine. Cocaine is a drug of addiction. It is obtained from the plant Cocoa erythroxylum. It inhibits the reuptake of the catecholamines, epinephrine, norepinephrine, or dopamine at the nerve ending, and thus it increases the concentration in the synaptic area. This is a stimulant of the nervous system, more powerful than the amphetamine. It has got, as compared to the amphetamine, it has got a shorter duration of action, but intense action, more severe action than it, and it more easily penetrates the central nervous system. It is a drug of abuse. Cocaine is taken intravenously or may be taken snorted, just like an aswad, something like that, or it is inhaled, or it is smoked. Then another drug, that is the ephedrine, and its analog, pseudoephedrine. These are the two drugs which are not the truth. Ephedrine is obtained from a plant, ephedra, which is more common in the China. Its name is mahua. The name of the plant is mahua. Another name is ephedra seneca. This acts in both the ways, directly and indirectly. Indirectly, it inhibits the reuptake of the catecholamines, and also it inhibits the release of the catecholamines from the nerve ending. And secondly, it acts on the postsynaptic receptors, both on the alpha and beta receptors acting. So the action will be just like those of the epinephrine or norepinephrine acting on the alpha receptors, causing vasoconstriction. By acting on the beta-1 receptors, they cause the tachycardia, increase in the force of contraction and rate of the myocardium, and also acting on the bronchioles, causing bronchodilation. Ephedrine and pseudoephedrine are the drugs which are orally effective. They have got a slower reaction, prolonged reaction. Most commonly, these were used in the treatment of the bronchial asthma. But now, as the better drugs are available, its use has been abandoned, but still commonly these are used in the treatment of cold. सर्दियों में जुकाम वगैरह में it is used in those conditions. Still these now mainly these pseudoephedrine, ephedrine are not metabolized, and they are excreted in the urine as such. As these are the bases, so they are excreted much efficiently when the urine is made acidic. Acidification of the urine causes its polarization, water solubility, decreased lipid solubility, and increase in the excretion of the drugs. These are, in some countries, these drugs are controlled because in many countries people use these ephedrine or pseudoephedrine in the synthesis of the amphetamines, which are the drugs of abuse. Most commonly also used in the treatment of nasal congestion and in the treatment of the sinusitis. Now, these were the indirectly acting drugs. Now, next one are the blockers of this action. There are two types of receptors: alpha-adrenergic receptors and beta-adrenergic receptors. They are classified into alpha-adrenergic blocking drugs and also the beta-adrenergic blockers. Today we will study the alpha-adrenergic blocking drugs. Alpha-adrenergic drugs are also classified into alpha-1 receptor and alpha-2 receptor. Alpha-1 receptor is present postsynaptically on the membrane of the cell, and presynaptic alpha-2 receptors are presynaptic, which are present presynaptically on the nerve endings. The activation of the alpha-1 receptor is that they cause the vasoconstriction and causes a rise of the blood pressure. While acting on the alpha-2 receptor presynaptically, they block it and they enhance or facilitate the release of the epinephrine and norepinephrine or dopamine at the nerve endings having its action. Now, most commonly, the old ones, the two old ones are the phenoxybenzamine and phentolamine. Now this alpha adrenergic blocking drugs also divided into two parts. That one is the reversible, the other are the irreversible. Phenoxybenzamine is an irreversibly acting alpha blocking drug. Its metabolite, intermediate metabolite, ethylenediamine, ethylenediamine is the intermediate metabolite of the phenoxybenzamine, which binds to the receptor by covalent bonding. Covalent bonding, it is attached there, it becomes irreversible, and the function of the receptor starts again only when the new receptors are formed. The phenoxybenzamine is not regularly absorbed when taken by mouth. The intravenous, the intramuscular injection and the subcutaneous injections are very painful, so they are given by a continuous infusion, intravenous infusion. It crosses the blood-brain barrier, and there it may cause the stimulation of the vomiting centers, may cause nausea and vomiting. The actions are that when these drugs, phenoxybenzamine, when it blocks the alpha receptors, it causes a fall of the blood pressure. When there is a fall of the blood pressure, then there is a reflex tachycardia. This reflex tachycardia is because of the two things. Number one is that centrally acting, they will cause the tachycardia, and secondly, by acting on the baroreceptors, they will increase the heart rate, and secondly, they will also inhibit the presynaptic alpha-2 receptors, and thus it will facilitate the release of the catecholamines from the nerve ending and may cause tachycardia by acting on the beta-1 receptors in the myocardium. This phenoxybenzamine also inhibits the histamine 1 receptor and acetylcholine receptors, and also the serotonin receptors. And adverse effects may cause orthostatic hypotension, stuffiness of the nose because of the dilatation of the blood vessels in the nasal cavity, blocking of the nose, stuffiness of the nose. Yes. This drug is mainly used in the treatment of the pheochromocytoma. Pheochromocytoma is the drug, is the disease, is a cancer, is the growth of the tumor of the adrenal medulla, where it increases the release of adrenaline and most commonly norepinephrine, and thus causing severe hypertension. In those conditions, in the treatment, or either it is used in the treatment, prophylactic treatment, or before the operation it is given, because the handling of the pheochromocytoma will cause an increased release of the catecholamines, causing the sudden rise of the blood pressure. Phenoxybenzamine most commonly act more on the alpha-1 receptors as compared to the alpha-2 receptors, while the other drug, the phentolamine, acts equally both on the alpha-1 receptor and on the beta alpha-2 receptors. This is a rapid. The action of the phenoxybenzamine is slow in onset and prolonged, while the phentolamine has got an action which is immediate and it is for a very short action, for a short duration. As it blocks the alpha-2 receptors, it facilitates the release of the epinephrine and norepinephrine from the nerve endings, so it may cause rise of the blood pressure and tachycardia sometimes. Tachycardia because of the actions of the catecholamines on the beta receptors, on the beta 1 receptor on the myocardium. Chronically used phentolamine causes the retention of the sodium and water. Now, the uses of these alpha-adrenergic blocking drugs are, number one, they are used in the treatment of pheochromocytoma, in which there is a rise of the blood pressure, there is apprehension, there is pallor of the face and of the body, and vomiting, nausea, and because of the tachycardia, chest pain may come. This is also used in the treatment of severe vasoconstriction, which happens after the extravasation of the norepinephrine when that is given intravenously. Extravasation causes severe vasoconstriction and may cause necrosis of the tissue, ischemia and necrosis of the tissue, in which case phentolamine subcutaneously in that area is given. Second is also when local anesthetics are given along with the epinephrine to prolong its action, vasoconstriction may persist for a long time. To counteract that vasoconstriction, phentolamine is also given. Another one is the hypertensive crisis. Hypertensive crisis after the withdrawal of clonidine. It is known that when clonidine is abruptly stopped, there is a severe rise of the blood pressure, hypertensive emergency. In that case, phentolamine is used. Then another one is to use this in the contusion. There are two other diseases in which they are used. One is the renal disease, and the other is the Burkitt's disease. These are used in renal disease. These are the two diseases which are of different origin. The renal, in which there are severe vasoconstriction in the extremities. The renal disease occurs most commonly in the females, and the upper extremities are involved in it. While in Burkitt's disease, the lower extremities are involved, and most commonly the men are involved. Men suffer from the Burkitt's disease. Then they are used in the frostbite, in which there is exposure to the cold, and where the extremity, especially the lower extremity, there is vasoconstriction, there may be necrosis, and there might be some amputation of the organs. Then, as these are the serotonin antagonistic, These are also used, this phentolamine is also used in the treatment of the carcinoid tumor. This carcinoid tumor occurs most commonly in the gastrointestinal tract, and sometimes it may occur in the lungs, where there is a fall of the blood pressure, there is flushing, watery stools, and bronchoconstriction. In these conditions, they are used. These are also used in the treatment of mastocytosis. Mastocytosis is a disease in which there is infiltration of the mast cells into the tissues. Thus, they cause an increased release of the histamine. As this drug, phentolamine, has got antihistaminic action, it can also be useful in the mastocytosis. So, then comes another group of the drugs that they act selectively on the alpha receptors. For example, the these are the few drugs which are specific for the blocking of the alpha-1 receptors. Little effect on the alpha-2 receptors. They are the selective blockers of the alpha-1 receptors. These alpha receptors are present, alpha-1 receptor present in the smooth muscles of the prostate, and also in the blood vessels. Now, this tamsulosin specifically act on the smooth muscles of the prostate gland, having little or no effect on those alpha receptors which are present in the blood vessels. So, tamsulosin causes little effect on the blood pressure, while the others are effective as alpha-1 receptors blockers. They are most commonly used in the treatment of the hypertension, but not as a sole drug in combination with the others, while tamsulosin is most commonly used in the treatment of the enlarged prostate, and it is not used in the treatment of the hypertension. In using these alpha-adrenergic blocking drugs, there is a complication that when the first dose is given, there is a severe fall of the blood pressure. When used is terazosin or prazosin or doxazocin, severe fall of the blood pressure, which is known as the first dose effect, This can be reduced by giving a smaller dose and giving that dose before going to the bed. Then the last one is the drug which is known as euhinline. Euhinline is a drug which is obtained from a euhinline plant. It blocks specifically the alpha-2 to presynaptic receptors and thus cause the facilitation of the release of the noradrenaline from the nerve endings. It is clinically not used. Sometimes it was used for erectile dysfunction in the males, but the studies have shown that it has got no effect in the erectile dysfunction. However, it may have some psychological implication. Okay, sir. Thank you.